Some breast cancer patients are prescribed chemotherapy or targeted therapy as part of their treatment. The whole course of chemotherapy usually takes about 3 to 6 months to complete. During every visit, the chemotherapy is being given intravenously via a needle. In order to reduce the chances of being pricked during the chemotherapy, some patients opt for an insertion of Chemoport. Chemotherapy drugs can be given through the Chemoport. This avoids insertion or intravenous needle every session. Chemoport can be inserted under local anesthesia or general anesthesia. So this can be done by a surgeon or an interventional radiologist. During the procedure, the catheter is being inserted into one of the large veins, either in the chest or in the upper arm, and then the port is buried under the skin on the chest. The port cannot be seen from outside, but you can feel a small little bump over the skin. To use the Chemoport, first the nurse will put some cream to numb the skin. After that, she will clean the skin with antiseptic before she put the needle into the port to withdraw blood sample or to put in medication or fluid. Chemoport reduces the number of times that the patient needs to be stuck with a needle during chemotherapy. This helps to reduce the physical and also psychological trauma for those patients who are undergoing chemotherapy. Potential complications of Chemoport includes infection and blockage. For infections, usually patients will experience pain around the port or redness. Sometimes they may develop fever or feeling unwell. This usually can be taken care by an antibiotic treatment. If the antibiotic does not settle the infection, then sometimes the port needs to be removed. For blockage, usually this is secondary to blood clots formation or what we call thrombosis inside the catheter. In the event of blockage, patient may experience redness or swelling around the port. Sometimes the nurse may find it difficult to withdraw blood sample or give medication through the Chemoport. This may signify that the catheter could be partially or completely blocked. The blockage can be cleared by flushing in the medication to resolve the clot.